A lot of people come to me and say, how do I pass PLAB 2? I spend a lot of time teaching people for PLAB 2, doing role plays, mocks, creating content through online courses and audiobooks and videos, etc. And there are certain things that I always try and tell people to think about focusing on to really enhance your chances of passing PLAB 2. I'm Dr. Arora. I'm a previous PLAB 2 GMC examiner, and I get this question, like I said, quite a lot. So I want to talk about 3 things in this video that I really think that you should focus on to try and maximize your chances of approaching this exam in the best possible way. Number 1, thinking about the situation as a global situation rather than just a condition. Number 2, thinking really about what is structure and how do I get it right. And number 3, the constant focus of keeping the story rolling forward. Okay, so I'm going to break these 3 things down, and hopefully for those of you guys who've attended our courses and used our material, these things should fit in quite nicely in terms of your preparation for PLAB 2. So number 1 then, think about the situation as a global picture. This is important both in data gathering but also in management as well. What I mean by the global picture, now you guys are all clinicians, okay? You're very used to seeing a patient, thinking about what the problem is, what's the diagnosis, and then managing that diagnosis. Now that's fine, and that will get you some good scores in certain cases that are purely clinical. But for most scenarios in PLAB 2, there is much more going on than just clinical, and you've got to train your brain to think bigger. Think bigger picture, think about the whole situation, not the condition. So from a data gathering point of view, that means asking many more questions than you may normally do in simple real life, where you're dealing with a simple problem or a symptom and you just want to get to the bottom of that clinically and then treat it. So for example, someone might come in with a headache, and of course you've got to think about what the headache is and go through your differentials and go through your clinical questions and go through the story. Of course you've got to do all of that, but when you think about trying to think of it as a global picture, we start to think about other things that could be useful to understand in the first half that can really help you in the second half in terms of maximizing your score. So for example, those of you who know the kind of things that we teach, we talk about 3 bubbles. We talk about red flags, we talk about psychosocial, and we talk about ICE. Why? Because these are going to give you issues that give you that bigger global picture. So life issues, for example, and mind issues, for example, alongside clinical issues, but thinking about ethical issues and health promotional issues. There are so many issues that you need to think about asking about in the first half to make sure you're thinking about this global situation assessment rather than just what is the diagnosis in front of me. So when you think about your data gathering, think big, and then also in your management plan, think global as well. We always talk about the concept of not thinking about condition management because that's what your brain wants to do, but thinking about situation management. How do I manage the whole situation in front of me? That includes clinical, that includes managing the mind, that includes managing the life. If you're not thinking globally and in a big way in management, then you're limiting yourself in terms of what I am going to manage or achieve in the next 2 or 3 minutes, and therefore you are limiting your ability to score well in the management plan. So the first thing to think about, the first thing to focus on when you're doing preparation, practice, etc., is thinking about the situation as a much bigger picture than your brain probably wants to do so initially, both from a bigger picture in the first half, asking many more questions, asking about many more issues, and then certainly thinking about a holistic global management plan of the situation in front of you, not the condition in front of you. That's number 1. Number 2, the thing to focus on, secondly, that I talk about a lot, is making sure you really understand what structure means and then get your structure right. Now, when most people have a PLAB 2 and they talk about the country, say, how do I improve my structure? Or I didn't score very well in structure, or I don't feel my structure is good enough. What they've been told or what they've been taught or what they're thinking is that structure is all about, basically what order do I do things? So PC, HPC, drug history, allergies, and this kind of, just conveyor belt that they try and do in terms of every single scenario, because that's the structure that they're trying to achieve. Now, when we talk a lot about structure, and you guys will know this from watching our videos and attending our courses, structure is not about what order do I do things in. Don't get preempted by what order should I do things in. You've got to have flexibility. You've got to have fluidity. You've got to have a conversation with the person in front of you whilst getting the job done. So for us, Structure is more about how structured are you in the conversation? How logical are you in the conversation? Are you jumping from one thing to another back to the first thing and showing an illogical approach, i.e. an unstructured approach? Now for me, it doesn't matter whether you do red flags first, then psychosocial, then ICE, or whether you do PC, then HPC, then drug history, then social history. To me, that doesn't matter. You can do it in any order that you want. But what does matter to me, and what I'd suggest you focus on, is being structured in whatever you are doing. So if you choose to do red flags at a particular point, doesn't matter when that is, get all your red flags done. When you choose to talk about psychosocial, doesn't matter when it is, but when you're in it, finish it. That is structure, okay? That is showing organization of thought whilst having flexibility. So one thing I talk about focusing on a lot when you do your role play practice and mocks and things that we run and online courses is that make sure, please, you focus on structure, but not in the way that you perhaps think structure is. Don't try and think about what order shall I do things. Think about how can I demonstrate better structure in the way I'm asking my questions, and you'll find that you have a much better conversation with the patient. It's much better interpersonally, and you're going to get a lot more out of that data gathering and therefore subsequently the management plan as well. So number 2. The third thing that I really want you guys to focus on when you're doing your preparation and practice and mocks and things that you do for PLAB 2 is more about the second half, and it's about the idea of constantly trying to think about how do I move this story forward. Okay, now when I do roleplay practice and when our assessors do mocks and things in terms of PLAB 2, people are often very preempted on getting to the end or getting to a certain point in a case or making sure that I've managed everything that I need to manage in 2 or 3 minutes. That is impossible, okay? That is absolutely impossible. You can't manage everything. You can't complete every scenario. But the thing that I really want you guys to focus on is thinking about, am I taking this story forward from when I first started? So when you first meet somebody, you're meeting them at a certain point in their story. I want to focus on, have I taken that story forward? Have I progressed it? Have I moved the bar forward? Have I firstly understood more about that situation? Have I asked the right questions? Have I worked out the issues in the case? Have I understood what's going on in the patient's mind, the patient's life, the patient's clinical world? So have I understood things first? But then have I focused on taking that story forward in the second half? Not just, okay, you've got a headache and I've treated the headache. Okay, that's taken the story forward a tiny bit. But have I thought about the other things that I could progress? You know, have I talked about what's going on in their mind? Have I taken that bit forward? Have I talked about a few things going on in their life? Have I taken that situation forward? Of course, have I dealt with the clinical problem appropriately and taken that forward, whether it's arranging tests or arranging referrals or certain treatments according to guidelines, etc. But just constantly focus on the need to take the story forward. Often when I'm doing practice with people to PLAB 2, we do a management plan, but it doesn't really seem like we've taken the story forward. The patient's still at the same point as where they first started, and therefore it's very hard to demonstrate that you're adding value to a particular situation if you haven't taken the story forward and kept the ball rolling. Sometimes you get situations where you get questions or situations that you don't really know what to do exactly. You don't really know exactly what the right treatment is. You don't really know what the right test is. But you can still focus on taking that situation forward. You may not have the answer. You may not have the exact thing that you think that you should know as a doctor, but you can still talk about things that you can do to enhance the situation. Talking to people who might be able to get answers like specialists, arranging a few tests, arranging to review in a week's time when you can solidify things a little bit better. All these things are demonstrating your ability to think about taking the story forward and therefore making the patient feel like they've advanced in their story. So even if you're not quite sure where you're going from a management point of view, always try and focus on, how do I progress this a little bit further? How do I do certain steps that may not be the ultimate answer, but demonstrate that I've been able to problem solve a little bit, think on my feet, and think in a real life situation, this is how I would progress the story so that the patient feels that we're actually getting towards point B from point A, even though we don't actually reach point B by the end of this particular consultation. So 3 really important things I think you should focus on when you're preparing for PLAB 2. If you want 10% off any of our PLAB 2 resources and courses, that could be our live roleplay course with myself, it could be our PLAB 2 mock exams, it could be our PLAB 2 online courses, gold package, flashcards, whatever it is that you want, please do use the coupon Arora Video 10, ARORAVIDEO10, If you're new to our YouTube channel and you find this video of some value, please do subscribe to the channel right now. Please do share this video and like and comment. It'd be really helpful for us to put more videos out there for you guys. But please do focus on 3 really, really important things if you are currently preparing for your PLAB 2 exam. Number 1, think about the global situation in front of you, not just the condition. Number 2, focus on what structure really is and how to improve your own structure in your consultation. And number 3, think constantly about the importance of taking the story forward before that bell goes at the end of the case. I really hope this video has been of some value. If you have any suggestions of any videos that you want me to cover, whether it's for PLAB 2 or for anything else that you think may help add value to the channel, please do let me know in the comments. You guys are awesome. Have a super day. #CampusWillPass. #I went with Arora. Take care.